My name is Kristen Chase, and I'm part of a group that will be presenting about EMDR, which stands for Eye Movement Desensitization Reprocessing. This is a presentation for NU 646 titled Theory and Practice of Contemporary Psychotherapy. Our presentation is with three people, including myself, Kristen, who will present key figures, historical perspective and development, key terms and concepts, then followed by Matt, which will give assessment, treatment approach, and a case study, and then Musi will present a worksheet, 3 EBP articles, and some resources. So my first talking point is about a key figure. There's really only one key figure in EMDR, and she is Francine Shapiro. She was born on February 18th, 1948 in Brooklyn, New York. She started out having a BA and a master's in literature, and then she was in a PhD program at NYU, and she was diagnosed with cancer, which then changed her entire focus on stress on the immune system. And then in 1987, the story goes that she was walking in a park and she realized that eye movements helped to decrease the negative emotion that came with her negative memories. So her thinking was that eye movements had a desensitizing effect. And she obviously started to experiment on this idea and discovered that other people also had the same response to eye movements. She started, after her experiments and case studies, she started adding a cognitive element to her method, and she named it eye movement desensitization, or EMD. In 1989, others started testing her method, and those results were very encouraging. And then in 1991, she changed the name of her method to eye movement desensitization reprocessing, to include the feedback that she got from the people that she was treating and the information processing theory that she had developed as an explanation of why eye movement works. Some key terms and concepts. I picked out 3 that were I felt were kind of most important to the method, and they are desensitization, which is the elimination or reduction of anxiety elicited by specific environmental or internal stimuli. Information processing is the process by which new perceptual information is stored, connected with associated memory networks, encoded and stored in memory. And then reprocessing is the process of forging new associative links between dysfunctional stored information and adaptive information, resulting in complete information reprocessing and adaptive resolution. Next, you will hear from Matt.
Before getting into the actual assessment of this modality, I do want to touch on some important points that I will be going over. So, EMDR is an effective treatment modality for patients suffering from post-traumatic stress disorders, panic attacks, complicated grief and anxiety disorders, amongst also some other disorders such as depression. It is an effective modality in facilitating the reprocessing of maladaptive memories. So it helps patients be able to live with traumatic experiences um, so that they are able to reprocess these experiences um, into a better understanding of themselves and the thoughts and fears that are associated with these experiences. The patients are also instructed to perform a pattern of eye movements at different moments when experiencing symptoms of these maladaptive memories, and they also include relaxation techniques, installation, bolstering um, during this type of therapy. And finally, um, during EMDR, they will be brought through an 8-phase plan to subdue these signs and symptoms. During the assessment phase of eye movement desensitization and reprocessing, there are 5 psychiatric assessments that are usually completed. So the first one is the patient health questionnaire. This is a self-questionnaire to determine the presence of depression, anxiety, somatoform, which is the physical bodily symptoms in response to psychological distress, alcohol, and eating dishabits. The second assessment that's completed is the symptom checklist 90R. So this assessment consists of 90 questions to evaluate symptoms that have been experienced in the last week, specifically last 7 days. They have to follow within the last 7 days. The symptoms that are included in this questionnaire include some of the similar ones as during the patient health questionnaire, somatization, obsessive compulsive disorders, interpersonal sensitivity, depression, anxiety, hostility, phobic anxiety, paranoid ideation, and psychoticism. Excuse me. Again, so it's just looking for some hyper activity in the patients. The third assessment that is completed during the assessment phase of eye movement desensitization and reprocessing is the dissociative experiences scale. So during this assessment, between 28 to 30 questions are asked. The patients must answer always or never when referring to the experiences of dissociative experiences, and this is known as a Likert scale. A score of greater than 30 indicates dissociative thinking or experiences. One of the main goals during EMDR is to decrease this score of this scale, and this is a sign of improvement. The next assessment that's completed is the multi-dimensional inventory of dissociation. Very similar to the DES above. It's just a longer version. It's comprised of 218 questions. It's formulated the same way by asking questions to answer always or never in regard to experiencing dissociative experiences. And pretty similar as well with the scoring. The range is from 0 to 10. A score of 30 or above indicates symptomology or dissociative thinking or experiences. And finally, the last assessment that is completed is the impact of event scale, used to identify the severity and nature of traumatic events and how these events have affected patients' lives. It's comprised of 22 questions, asking the patients how these events have bothered them within the last 7 days or again a week, and it's it's specifically aimed at intrusion, hyperarousal, and avoidance behaviors. To summarize what these assessments look for, the presenting signs and symptoms that are aimed during these assessments can be found on the right of the screen. They include dissociation, anxiety, depression, hyperarousal, avoidance behaviors, somatoform, substance abuse or poor eating habits, obsessive compulsive symptoms, phobias, paranoia, and hostility. These are just, again, a summary of what the previous 5 assessments are aimed to look for in patients who are looking to be treated with EMDR. Following the signs and symptoms that are presented with patients, it's important to know the DSM-5 diagnosis that would benefit from this type of therapy. So the first diagnosis that we have is post-traumatic stress disorder. This is the most commonly associated mental illness that is experienced when seeking advice or help through EMDR. And so the DSM-5 notes this diagnosis as direct or indirect exposure to traumatic events, followed by symptoms categorized into 4 sections. These sections include intrusion, avoidance, negative changes in thoughts or moods, and or changes in arousal or reactivity. And that's just a summary of it. The next diagnosis is panic disorders, which are classified as acute or abrupt onsets of intense fear or discomfort. The third diagnosis is complicated grief, and this is the consistent or persistent grief commonly characterized by yearning or longing for a specific part of this diagnosis. Patients must be accompanied by 3 of the 8 following symptoms. These symptoms include disbelief, intense emotional pain, feeling of identity confusion, avoidance of reminders of the loss, feelings of numbness, intense loneliness, meaningless, or difficulty engaging in ongoing life. So again, patients must experience at least 3 of these or more to be diagnosed with complicated grief. Following complicated grief, we also have depression, which is characterized by the persistent sadness or lack of interest in pleasure in what used to be pleasurable or rewarding. This is a pretty common diagnosis. And then finally, we have anxiety disorders, also a common diagnosis, and this is the intense worry or apprehensive expectations that occur for 6 months or longer, and they usually occur on more days than not. So now that we have a basic understanding of the eye movement desensitization reprocessing therapy, we can now go into how we approach treatment. So there's an 8-phase approach to this type of therapy. It starts with patient history and information gathering. Here is where the healthcare provider gathers the patient's information and history to determine if EMDR is the best therapy for the patient. After this phase, we go to the preparation and education. So after determining that EMDR is the best fit, we will then educate the patient on the process of EMDR and will inform the patient on the safety measures that will be taken so that the patient can feel safe and comfortable during this type of therapy and that they can manage their emotions appropriately. The next phase is the assessment phase, and this is where those 5 assessments come into play. Here we like to indicate the themes, memories, and symptoms that have taken place to determine the focus of this practice. We also like to identify the negative and positive beliefs that will be addressed so that we can focus on those positive beliefs, which will help better the patient. We will move on to talk about steps 4 through 6 now. So the 4th step, in which I believe is where the therapy gets its name from, the desensitization reprocessing phase. This phase is made up of activating the patient's memory to identify 1 or more specific negative images, thoughts, feelings, and body sensations while engaging in eye movements. So during this phase, the provider will assess bilateral stimulation, specifically eye movements, which are associated with the trauma to reduce the vividness and emotions associated with this trauma. This phase helps bring to light the negative thoughts and feelings associated with these experiences. The next phase is the installation phase, where healthcare providers focus on the post beliefs that will be the base for the patient's building of one's core memory. And then finally, the sixth phase is the body scan phase, mainly to identify the progress of EMDR. The provider will focus on the patient's sense of how they feel throughout their body when experiencing any symptoms brought about during the fourth and fifth stage. For the last two phases of this treatment approach, we have the closure and stabilization phase and the re-evaluation and continuing care phase. So during the closure and stabilization phase, the healthcare provider will discuss with the patient what's expected during and in between sessions. The patient will be educated on stabilization techniques, relaxation techniques, etc., to calm themselves when triggers come about. These sessions end when the patient feels comfortable and safe enough to move on. And the last stage is the reevaluation and continuing care phase. During the final stage of EMDR, the provider will discuss with the patient the progress, and this phase is used to determine if more sessions and more therapy should be continued after meeting a certain goal. Some techniques that are used during EMDR and specifically in between sessions include daily journaling, which helps track the patient's progress, as well as focusing on management. It helps the patient be able to manage their emotions and experiences when they write down these thoughts and emotions. The next technique includes self-help techniques such as visualization. So this uses imagination to vision yourself in a peaceful environment to help relax oneself. The next technique, similar to visualization, is imagery, but more so in an almost negative aspect, is picturing yourself facing your fears. So this allows the patient to stimulate themselves, put them in a hyperarousal state, so that they can practice EMDR or other relaxation techniques as well. The next technique that can be used is progressive relaxation. The use of this type of therapy involves the tension of different muscle groups and then releasing these tensions to allow relaxation to take place. And then finally, breathing exercises, slow, deep breathing helps decrease stress and puts more attention on the expansion and inspiration of air into the lungs, and then as well as the expiration out of lungs. It puts a different focus at that time of the patient's thoughts rather than those experiences and emotions that are going through their head. These are just a couple of techniques that are used during EMDR and in between sessions. It's not limited to just these ones. For the case study example, we have Anthony, who is a 45-year-old male who previously served in the military for 12 years. During his 12 years in the service, he served 3 tours in Iraq. His services were discharged due to his experience with post-traumatic stress disorder. While his family consisted of his wife and his 2 sons, have been a positive support group for him, more therapy is needed as determined by his psychiatrist. He is sent to the VA where he will participate in eye movement desensitization and reprocessing therapy. Anthony completes the first 3 phases of his EMDR therapy in his first 2 sessions. He begins by informing the therapist about his history in the service and the traumatic experiences he faced. He mentioned multiple mass casualty incidents that are frequently brought up in his memory, which he struggles to cope with. After discussing his history, the therapist determines that EMDR will be the best fit for Anthony's situation. He begins to fill out the assessment forms in his second visit. During the patient health questionnaire, Anthony notes events of depression within the last 7 days. He states he has had multiple days of feeling unmotivated, sad, and anxious due to the thoughts of this time in the service. He relates this questionnaire to the symptom checklist 90R with the same experiences of depression and anxiety. He also notes that during this experience, he becomes drawn back and secludes himself from those around him. He also tends to become hostile when constantly asked if he is doing okay. He scored a 37 on the dissociative experience scale and a 41 on the multidimensional inventory of dissociation, making him a candidate for EMDR. These scores will be used as goals for him to decrease in each session. Finally, he notes various avoidance behaviors noted on the impact of the event scale assessment, saying that he secludes himself, doesn't feel like talking to anyone, and that he wants to do nothing with my life when these experiences come about. We will follow the 8 phases of EMDR for Anthony to follow so that he can receive effective care. He has already completed phases 1 through 3 in the patient health and history, the education, and the assessment fields. From here, the therapist has decided that Anthony will begin with 2 weeks of EMDR therapy. During the first week, he will attend a session once a day. At these sessions, phases 4 through 7 will take place. Anthony will not be sent home until he feels safe and comfortable after each session. During his sessions, he will be asked to face his fears and practice imagery. Imagery will not take place by himself, but it will be important for him to place his experiences in his mind during therapy so that he can practice efficient EMDR and relaxation techniques. When Anthony is discharged from each session, he will be sent home. If experiences come about while he is home, he will be asked to practice relaxation techniques, including breathing techniques, journaling, and visualization by himself. The breathing techniques will allow him to take his mind off of the experiences and focus on his breathing to relax himself. The journaling will be used so that he can make progress and track down what he feels during each experience and or relaxation technique. During his second week, Anthony will have visits every other day. Phases 4 through 7 will be conducted during each session along with imagery practicing relaxation techniques. In between sessions, Anthony will be continued to ask his breathing techniques, his journaling, and visualization. The same phases will be continued through the second week to mirror those done in the first week. At the end of the second week, Anthony will undergo the final phase of EMDR and be re-evaluated. He will repeat the 5 assessments that were completed in the third stage of EMDR at the beginning of his sessions. His scores will be assessed from there. The goal for Anthony is to decrease his occurrences of negative and debilitating behaviors and for the scores of the EDS and the MID assessments to be lower than 30. If he still has consistent negative behaviors or experiences or has a score above 30, more sessions will be added starting at every other day and decreasing to every 2 days until once a week. At this point, Anthony will be reevaluated again and continued steps will be taken from there.
Hello, this is Musty. I worked on finding a worksheet that acquires the EMDR that clinicians can use while working with patients. So this worksheet has 7 phases. Phase 1 and 2 are not provided on this worksheet because phase 1 is to identify the history and treatment plan to see whether if EMDR is inappropriate for this patient. Phase 2 is to prepare and help the client come up with a safe environment that they can zone into while receiving the EMDR treatment. And the worksheet starts with phase 3, which if you look more into it, it goes step by step from all the phases from 3 to 7, which 7 is closure of the phase. So I thought this worksheet was very helpful to understand the steps of EMDR, and I personally work with a therapist for one of my clinical sites, and she does EMDR. So I had spoken to her about this project that we were doing, and I showed her this worksheet that I had found, and she said that this is mostly identical to what she does and what she has been using in her practice as a licensed EMDR therapist. So I found a couple of articles that used evidence-based practice regarding EMDR. The first article I found was Management of Post-Traumatic Stress Disorder in Adults. So in this evidence-based practice, they had a trial that was done to evaluate psychotherapy treatments and to see that which ones would be beneficial for PTSD clients. In the trial, they focused on traumatic-focused cognitive behavioral therapy, exposure therapy, stress management, cognitive behavioral therapy, and EMDR. From this article, the outcome found that EMDR was superior to stress management in treating PTSD in 2 to 5 months following the treatment and was more effective in therapy in comparison to the other types of therapy. So with that being said, it kind of showed that EMDR can be very beneficial for people who have been dealing with post-traumatic stress disorder. The second article I found was regarding prolonged grief disorder in adults, and in this article, they use EMDR as a type of psychotherapy to help with prolonged grief, and it showed that EMDR was able to help come to terms with the grief and be able to process it in a way that allowed the client to find closure with that type of grief, which I thought was very interesting to know that along with PTSD, it can help with prolonged grief. The third article I found was Anxiety and Schizophrenia. This article compares prolonged exposure therapy and EMDR to reduce PTSD symptoms in patients with PTSD and other psychotic disorders like schizophrenia and schizoaffective disorder. So the outcome of this article showed that patients who received EMDR therapy experienced less severe PTSD symptoms and had lower rates of meeting the criteria for PTSD diagnosis. So as they received the EMDR treatment, the PTSD that they had started to become less and less because they were able to close out those memories and issues that they had been dealing with. So all three of these articles I found were very beneficial in helping me understand how EMDR has been used in practices and how it has been proven to be helpful for patients. Alrighty, like I had stated before, I work with a therapist who is an EMDR licensed specialist at one of my clinicals, and she said that she used this specific website to get her training and to be licensed, which I have provided the link right there. But she had told me that there are 5 steps that are required to be fully trained. And step 1 is to understand what an EMDR training consists of, to make sure that you are eligible to attend an EMDR training, to make sure that you have all the required information, documents needed. And the third step is to find an EMDR training. The fourth is to register. The registration process can take a while because you have to have all your proper information provided there. And the fifth is just to complete the EMDR training. And in order to complete it, you need at least a minimum of 50 hours of training, which I thought was a good, decent amount because you have to be able to know exactly what EMDR requires and how it can help patients in order to actually be able to help someone. And I feel like 50 hours is a good amount because you are experienced and you can understand and provide this type of service. So for the conclusion, I found that based on the information provided throughout this PowerPoint, I believe that EMDR is a useful therapy modality for someone who is suffering from post-traumatic stress disorder, panic attacks, complicated grief, and anxiety disorder. EMDR activates the right and left hemisphere of the brain to process a traumatic memory that can be that can cause distress in someone's day-to-day life. These memories that people hold on to are brought up subconsciously without someone making the realization that I am acting this way due to something that happened in the past. And this type of therapy can help the patient close out that memory so that they can prevent those happenings. So I hope this presentation was helpful and it was beneficial to learn more about what EMDR provides to patients. Thank you.
So this is a list of our references, and that has been our presentation. I, Kristen, Matt, and Moosey, thank you for listening, and we invite your questions. Thank you.